Hello, I'm Tessa Slater. I'm Programme Facilitator with the Productive Care team, and I'm here at Temple Cowley with
Becky, and I'm one of the community nurses.
And I'm Cherise, the healthcare assistant.
That's lovely. And we've been working together with you with the Productive Care modules and programme for about a year now, and it would just be good to try and catch up how you feel it's gone for you and how you started and what your benefits you found to be. So Cherise, I know that you were very instrumental in looking at the well-organised working environment. How did you start to do that as a team?
We kind of sat down and kind of worked out what we need to tackle first, really. Looked at the stock levels and the cupboards and does everything need to be there, really. And we did have a lot of stuff that was out of date. So we kind of decided to work through and sort out exactly what we do need, to work out exact stock levels of what we want to maintain, and really went from there.
And what benefits have you seen for having a system like that?
So I just think it's just saved us so much time, really. We save a lot of time from going to find something, because we've got 3 different store cupboards as well in different places. It can take quite a lot of time to locate things sometimes, and now we all know where things are and where we will find them. It's made it a lot easier to save that time.
So as clinicians it saved you time. What about your admin support? Do they find they save time with ordering?
Yeah, definitely. We've got stock labels with the pictures along with the ordering codes and the stock levels all on there now as well, so that has made it a lot easier, especially the ordering systems aren't particularly brilliant as well, so it's made it a lot easier to locate things and order them a lot quicker.
That's great. And you have the use of the DN bags which you take into people's houses. How have you found that?
Very helpful, because we have the stock there when we need it. I mean, most of our patients do have the stock in the house ready, but there are occasions when you go to someone else's patient or first visit where the stock's not there. And if you go into residential homes and they ask you to see an extra patient, you haven't always got the dressings there that are needed.
Mm. So what have the benefits been for you, and what have the benefits been for your patients, do you think?
I find that it saved time, visit time really, because you haven't got to come back to the office to get the dressings or the stock that you need. And also saves a lot of worry for the patient, because you haven't got to go back and disturb that patient again.
Yeah, great. And so that's been your well-organised working environment, and I know you've looked at other documentation and things like that, but perhaps talk me through your patient status at a glance and how you decided what to put on your board.
Well, we decided to do B12s and catheters because they are done 3 months apart, so those dates are more likely to be missed than our regular visits. We just wanted really to have the information in front of us so that we can make sure the dates are on Rio and we know who the GP is and who the named nurse is, so we can make sure the notes and things are up to date.
And is this a system you've been working with for a while?
Yeah, and we're still planning to review some of the headings.
Yeah, that's great. And you have a key. How did you decide upon that?
Well, we just thought green for yes and red for no, and then we have little red dots for any patients that are in hospital, so we can always get in touch with the hospital to arrange for them to give B12s or to change catheters.
Lovely. And what have you found to be the benefits for yourselves and your patients? What do you think the benefits have been of a system like this?
Their visits aren't missed.
I think it saves a lot of time, really, doesn't it, as well, because you kind of don't have to look on all the different computer systems to find out is something necessarily due that day, because obviously with catheters, if you get a block catheter, you sometimes have to change the date. So it's just kind of keeping it all up to date, and then you've got that information right in front of you. You don't have to look around everywhere for it.
And how did you work as a team, how you might keep it up to date, or when you use it?
Yeah, we tend to use it kind of for handovers, because we do handover in this room, so we've got that in front of us, so we can kind of make sure we're reviewing it as we go along during the handover session and update it as we need to.
And I think also if you see on the GP system that the catheter's been blocked and has been changed, then we can change that to make sure that the visit isn't unnecessary, really.
Yes, that's great. That's good to hear. So have you any other thing you want to add about productives, or what you perhaps want to do next?
I think the next thing is to review the headings, just to make it a bit more beneficial, I think, to us.
Yeah.
Yeah, just continue to sustain like all the work that we have done, really.
Brilliant. Thank you very much.
Thank you.